Hello, this is Eitan Shalom at the Body Mind Wellness Center, and today I am treating someone with chronic low back pain. He does not have a disc injury, but he does have chronic tightness. He was in a bunch of accidents earlier in his life, and I saw him for a while, about a year ago or year and a half ago, and we got a lot of progress done, and then he went on to do a lot of deep tissue body work, which I was very in favor of. And now he's come back again after a break of maybe 6 months or 7 months for some more work. And so he complains of tightness in his low back, especially on the right. That's why there are more needles on the right than the left. And also a lot of tightness in his pelvic girdle, in his glute medius and minimus, and also in the SI joint. And this is what he feels, and also what his body worker, his deep tissue body worker, confirmed. So what I'm doing is dry needling of the, trying to get a better angle. Here we go, that's better. Dry needling of the paraspinal muscles here, that's that line there, paraspinal muscles right and left. And then the motor point of the quadratus lumborum on this right side, which was very tight in his case. That's the motor point of the quadratus lumborum, this point right there. And you'll see that this needle, you okay? Mm-hmm. So he's deep breathing that's called the pistoning technique in dry needling. I'm gonna do it one more time so you can see. There we go. And I'm gonna just do that here. Take a nice breath, Mark. Exhale. So when you're doing any needling that's going to be a challenge, it's always good to have the person breathe. So motor point of the quadratus lumborum, trigger points in the paraspinal muscles, in the muscles and fascia both, motor point of the QL on the left, and then on the right and left side each, I've done the motor point of the gluteus medius and minimus, which are, and the real strong one was this one. Keep breathing. You okay?
Yeah.
Okay, so, and same, so you see this is a big motor point here, and I'm getting at it from two different angles, these two yellow. The pink needle is less important. In fact, I'm going to take that pink needle out. So I tried to needle it with a smaller needle and then switched to the larger needle, and I left the smaller needle in. So you see the motor point is down underneath my finger, and I'm getting at it from two different angles. And I chose to do that. I needled the first spot by palpation. I mean, I know where the point's located, but I pressed around to see what was tight. And then after I needled it, then I could feel that it's really tight in a larger area. So I did that second one. And here we have the motor point of the piriformis. And then this is a point into the fascial sheath that runs over the sacrum. This is actually an acupuncture point used for back pain. And when I looked it up, lo and behold, it releases the fascia. I once needled this on myself, and I have chronic low back problems, which is how I got into Chinese medicine in the first place, part of how I got into it. And I needled this point, and I felt almost like, I call it like sheet lightning, a wave of release through my low back. It was amazing, and it was like a vibration of the underlying fascial layer. Okay, thanks for tuning in.